My name is Peter Snow, and I'm a member of the steering committee for the Out of the Cold program in Georgetown. This is the first in a series of 5 videos about mental health support and de-escalation. First, let me tell you about me. So my background is in social work. For 10 years, I worked in frontline mental health care, including 2 years working in emergency psychiatric medicine. Currently, I work in knowledge translation, which is a fancy way of saying I help people learn how to be more helpful and to use best practices in mental health. So in this series of videos, I'm going to be covering 5 topics. Each of these videos will be available in a playlist, and we hope you'll watch all of them, because I think that each of these skills will be very useful in your time with Out of the Cold. Our first video is an introduction to mental health support. In the second video, we'll discuss active listening and related skills. Our third video deals with managing panic attacks. The fourth video deals with suicide. And the fifth video is about de-escalation. Now, these videos are not a replacement for more comprehensive training, such as mental health first aid or assist. We will share links to these kinds of trainings in the descriptions of the video, and we recommend that you look into these and attend further training. Before we begin, I want to start with a mindfulness exercise. Now, if you're not familiar with the concept of mindfulness, it is a practice that has become a major part of mental health treatment and care in North America. What mindfulness essentially is a kind of meditation. And what it really is a bringing awareness of yourself, where you're at, and your surroundings. I would encourage you, before you work each shift, to take a moment to check in with yourself, to see how you're feeling, what you're experiencing, what kind of mood you're in. That will be useful in helping you set the stage for the work that you're going to do in Out of the Cold. And we'll discuss more about this as we work through today's video. But to start, I want you to close your eyes if you're comfortable, or find a spot in the room where you can fix your gaze so that when it wanders, it can return. Now, as you sit, begin to bring your attention to your breath. Notice how your air comes into your lungs through your mouth or your nose, fills up your lungs and pushes out your diaphragm. And then notice as you exhale and the breath comes back out. You don't have to change the way that you're breathing. Just pay attention to it. Now, as we work through this, you're going to notice your mind begins to wander. New thoughts and ideas will come in. And that's okay. You're going to notice what the thought or the feeling is. You're going to acknowledge it, name it, and then let it go gently. There's no need for judgment. Just let the thought come and go. Continue to focus on your breath as the air comes in through your nose or mouth, into your lungs, and then back out. Now I'd ask you to take 3 final breaths and then bring your attention back into the room. Welcome back. Now that was a very brief meditation exercise. It may have seemed very long. You can certainly do longer more involved meditation practice. Perhaps you already do. You can find apps to help you do this, videos, books, lots of resources about mindfulness. So let's shift now into the question, what is mental health support? What are we talking about today? So mental health support is help for someone experiencing a mental health challenge or a crisis. And this can look like a lot of different things. As we work through the next 5 videos, you'll see some of the challenges you may experience with some of the guests in our program. Mental health support is about empathy. It's about kindness. It's about compassion. It's about the reasons that have likely brought you to our program in the first place. You're probably volunteering because you want to help people. And that's amazing. It's a perfect place to start when we're offering mental health support. It's also something that's offered in the moment as a bridge to other kinds of help that might be necessary, or if the crisis situation ends. So you may find that your interventions are enough to diffuse the situation, to calm someone down, to help them move forward. Or you may require additional support, and we'll discuss what that looks like later on. Just as important about what mental health support is what it isn't. It's not therapy, it's not counseling, it's not treatment. There is no expectation that you're going to fix someone's problem, or resolve an issue, or help someone recover from a mental health issue. You're not experienced in that, you're not trained in that, and we wouldn't want you to do that. It's also not something that you have to do alone. All of our shifts at Out of the Cold feature more than one volunteer. You also have backup support, which you'll be made aware of through your training to join our program. You're never alone. So when do we use mental health support? Well, suicidal thoughts or behaviors, and we'll talk about those in the 4th video. Emotional distress, which can happen for a variety of reasons in a variety of situations. Types of non-suicidal self-injury. What that means is someone deliberately hurting themselves in a way that's not going to kill them, but certainly can cause harm and distress. Trauma responses. So often people have experienced trauma. Many of our guests have been through traumatic experiences in their lives, and things in our environment or in their experience with us will cause them to relive or re-experience some of those feelings. Psychosis. So this term may be familiar to you, it may not. It's a technical term that we use to talk about the experience of hearing things, seeing things that may not be there, experiencing thoughts that may not be rational or aligned with the reality that's going on. And some of our guests will experience these, whether it's due to a mental health diagnosis or to use of drugs. Those can all cause psychosis, as can other medical issues. And the last thing is aggressive behavior. Arguments, fights, disagreements. And this is de-escalation. And we'll talk about this in our 5th and final video. Let's talk about emotions, though, because emotions really are the foundation of what we're doing every day in our program. You know, you may experience a lot of different emotions in a given day. You may have names for all of them. You may not. Some people can identify 6 emotions, 7 emotions. You know, psychologists are very much debating how many actual emotions there are. But for our purposes, I think we can think about a huge range of emotions that we might experience. From sadness to embarrassment to happiness to cheerfulness to joy to frustration. All emotions that we may experience and our guests may experience. And to be clear, understanding your own emotional state is really important, as much as understanding someone else's. And we're going to talk more about that as we move through. So how does an emotion happen? Like, what is an emotion about? Well, we tend to talk about emotions as having a cycle. They're not something that happens just out of the blue for no reason, and then it's over. We go through a whole process when we experience a feeling. There's something that triggers that feeling. We may know what that is, we may not. We then interpret that trigger, that event, that thought, that experience. in some way that causes us to have a feeling. That feeling will be accompanied with physical sensations, many of which are similar between different kinds of emotions. We'll then feel an urge to do something about that feeling, to soothe it or to lean into it or whatever it is. That can lead to an action. That action can then lead to after effects, and those after effects can often be things like more of that emotion or consequences with the people around us, or even good things. There can be good after effects of an emotion. We talk a lot about emotions in terms of the negative ones, the ones we don't see as positive, like anger, frustration, sadness. But this same cycle applies to all of our feelings. Joy, happiness, excitement. Those are all experiences that follow the same pattern. Prompting event, interpretation, physical response, the urge to do something, doing the something, and then dealing with the after effects of that. So when we're practicing our mental health support, we're practicing dealing with emotions. So then how do we do that? Step 1 is to build rapport. Now, rapport can be defined as the relationship we build with people, that closeness, that comfort we have with someone. Now, to be clear, as a volunteer with Out of the Cold, your job is not to befriend our guests. Your job is not to build these close emotional relationships. Your job is to build rapport with them so that they're comfortable with you, they trust you, they feel like you're listening to them and you understand them as much as possible. But we want to be very clear with the boundaries we set up with people. We have a role as volunteers in the program, and that is to put the needs of all of our guests first and foremost. So how do we build rapport? Well, the best tool for managing any difficult situation is going to be that pre-existing relationship, right? So it's essential that we talk and we listen and we spend time with the guests. We're going to try to understand their story. We're going to try to understand them. And it's true that sometimes the things they tell us won't make sense or won't fit with what we know, and that's okay. A lot of times it will. And a lot of times you're going to build these nice relationships with people who you may never see again. Now, the building blocks of good rapport are empathy and validation. They're the most basic skills we can use to build a good relationship with anyone, including our guests. In our next video, we're going to be talking more about empathy, validation, and the other skills that we can use to build this relationship. So in summary, mental health support is the way that we, as volunteers with the Out of the Cold program, can support our guests with the various needs that may come up over the course of an evening, a week, a month, whatever it may be. And we're going to do that by building strong relationships with our guests so they know they can trust us and they know that we'll listen. If you have any further questions about any of these videos, please reach out to Reverend Booze or contact me directly. I'll share my email with all of you. Happy to talk more about these topics. And I will see you in part 2, where we'll learn about skills for building our relationships. Thank you.